Have you ever wondered about the significance of thorough immunization tracking and coverage? Take a moment to ponder the plight of a Tier 2 health facility in Kenya. From March to October 2021, out of a total of 875 recorded births, only 78% had clear documentation of receiving necessary vaccinations at birth. This lack of accountability resulted in a 22% gap, revealing a clear problem: missed opportunities for vaccination, multiple vaccinations, and most importantly, lack of immunity for newborns. The aim was straightforward: achieve full accountability of essential vaccinations at birth, ultimately reaching 100% coverage. The stumbling block? Inadequate documentation of vaccinations given at birth. The solution? A quality improvement project commencing with the development of a standardized vaccination documentation form, a checklist, an immunization log card, and mandatory documentation training for healthcare staff. The results were significant. The implementation of a standardized documentation form resulted in a notable increase in the documentation of vaccinations. A comparative analysis revealed that out of 414 deliveries from March to June 2022, only 2% of records lacked clear immunization information. This improvement in documentation led to a corresponding increase in the number of infants receiving vaccinations at birth. The mandatory training for healthcare staff boosted their understanding of the importance of vaccination documentation. This knowledge translated into improved documentation practices. Regular audits of vaccination documentation served to identify areas of improvement and ensured that these new practices were maintained. The impact of this project was profound. More efficient tracking of vaccinations from birth led to an increase in the number of infants receiving vaccinations, thereby boosting overall immunity. This also resulted in a decrease in healthcare costs by reducing the need for catch-up vaccinations later on and prevented multiple vaccinations. The interventions implemented in this project can serve as a model for other healthcare facilities striving to improve their vaccination tracking practices. Adams Marithi, a freelance clinical researcher, patient safety and quality champion, and a dedicated RN, played a pivotal role in this project. This goes on to show how meticulous planning and thorough implementation can make a significant difference in the healthcare industry.